Hi, this is Chris Frew with BioBuzz, and we're here at the QNova LifeSciences Partnering Forum, part of JP Morgan Healthcare Week. And I'm excited to be talking with Gil Travish today. Gil, thank you for joining me.
Thanks for having us.
Yeah. My pleasure. Why don't we start off? Tell us a little bit about you and your company.
Great. So I am Gil Travish, and ViBo Health is the company. What we're doing is non-invasive health scanning and early warning for diabetes and other chronic conditions.
Great. And I'd love to hear, so what are you here to accomplish this week? Why are you here in San Francisco?
Yeah, so as you know, JP Morgan is focused around pharma and biotech, but there's a growing amount of med tech and devices. And I was surprised by just how many people I've run into are in that area. So we've had very good sessions, and we're really here to grow the network, of course, meet investors, but also partners and get the word out.
Yeah, that's great. I mean, with everybody coming together in 1 week, one place, it's probably a great place to get the word out.
It is everyone in one place. Yeah, things get busy.
Yeah, you can tell. Well, so as things are getting busy, when you're out here working to build partnerships and meet with people, who are the type of partners that you're looking to connect with here?
Well, ultimately, it's a range of, takes a village, right? So we do want to meet with employers because employer health is important to us. We want to meet with people who are on both the provider side and the payer side. But we're not necessarily targeting any one specific group. We think there's a wealth of people who can help us get to the finish line. And the problem that we're addressing is so large that it really impacts everyone up and down the scale of healthcare.
Yeah, I'd love to talk about that problem a little more. So can you talk a little bit further about the problem you're addressing and kind of the impact that it does have in the healthcare system?
Yeah, so there's been a lot of discussion about getting to the pre-patient, precision health, finding disease early, but there hasn't been as much progress in that area. And so that's what we really address, is going out there and finding the people who are diabetic and don't know it, or who are pre-diabetic and could easily do lifestyle modification or therapies and prevent diabetes from occurring. As you know, the consequences of having diabetes can be severe, especially untreated. And those put a huge burden on individuals, but also on the healthcare system. So 1 in 4 of our healthcare cost dollars go to diabetes, and we really see a way of turning that around and being part of that solution.
We've heard a lot about bringing technology to the patient. That's been a theme we hear a lot about. Tell us about how you're accomplishing that.
Yeah, absolutely. So we go all the way in the sense that we're outside of the clinic. We put our devices, which are tabletop systems, into pharmacies, into workplaces, into conference centers, wherever there's high traffic, and people can use this device, our DigiScan, as often as they see fit. Could be daily, could be weekly. And it's free to the end user under the business model. The idea is take away all the friction. It's completely pain-free. It's nearly instantaneous. And so there's no reason as you're walking by, you just take a reading and it pops up on your phone later. And if you have a trend that's negative, that's when we alert you to take the next action.
That's great. So it's kind of like when you used to go to the pharmacy and get your blood pressure,
Exactly.
Same concept?
That's a great predicate device. I'd say the one difference is that our system is a bit faster, and we're not measuring one parameter, right? We really look at the biochemistry, and we measure multiple metabolites, so we have a little bit more robustness to what we're reading.
Yeah. So Gil, as you look to 2026, what's the next milestone that you're working towards?
Getting a better crystal ball to predict the future.
No, let me know when you get that.
Yeah, we're working diligently. We have our prototype, and we're working towards our MVP. And I think that's probably a reasonable goal for the end of 2026. We also are going to be raising a seed round, and obviously that would help accelerate that work.
Terrific. Before I let you go, so what's it been like? Do you work with MTEC or?
Yeah, we're part of MTEC, and we've applied for different grants through them with the military, because we have healthcare that allows for sustaining warrior health, both on the field potentially, but also just back at the base. And we also see it as part of the return to duty and fitness and performance. And so we continue on that journey as well.
Great. What have you thought about the QNova forum so far this week?
Yeah, it's been actually surprisingly good for us. We've had some strong meetings, and we're hopefully meeting some private equity people that a few steps down the line, but good to line up those contacts as well.
Well, that's what it is. Starting the partnerships now.
Absolutely.
And so when you're ready for your seed round or your investment, it's right there.
Absolutely. Yeah.
Hey, Gil,
Great.
thank you so much for talking with me today. Really appreciate it. Really excited about everything you're doing to improve patient care and the health system. So best of luck this week.
Thank you.
Yeah.
Thank you.
Thank you for tuning in. This is Chris with BioBuzz.